Mauree.
Thank you very much. And thank you to each and every one of you for being here with us. We have limited breaks where, on rare occasions, we actually try to eat lunch in the cafe or something. And these folks are here, I know, because they agree with our mission to share today as it relates to the decision that's before us. I think Chairman Baker did an excellent job of giving a comprehensive overview of the hearings and the information that we're able to garner from those hearings and the numbers. So I'm not going to talk to you about that. I think you all heard that loud and clear. I'm going to talk more about the program as it is and the real people that we serve and deserve to be served. I think every one of us is here today because we recognize and we appreciate the crucial function and value our Commonwealth's current Medicaid program. From the beginning, the Medicaid partnership between the states and the federal government was designed to create an essential safety net for our most vulnerable, impoverished citizens, rightly so. Our elderly and ever-growing poverty level seniors, are physically and intellectually disabled, those pregnant individuals living in poverty, and of course our children. It's our responsibility to determine and maintain a common sense way to ensure reliable, efficient, sustainable health care for our neediest citizens. They deserve a program that provides adequate access to providers and quality health care. Chairman Baker alluded to this fact. Our current system is overburdened. For over a decade that I've been here, many of the people behind me have worked with me on looking at our public assistance, our welfare, our Medicaid programs to make them as functional and efficient as we can. We've made some progress. However, the numbers are still overburdening. If we keep on the current trajectory, even as it is, the plan is unsustainable, and it's potentially harmful to both our hardworking Pennsylvania taxpayers and to the population that our Medicaid program serves. It's clear that a full expansion of the MA program, as we elevate it to the much higher percentage above federal poverty level, we're going to add hundreds of thousands of people to an already overloaded system. We simply do not have enough doctors and healthcare professionals to provide the necessary primary care. The number of providers is diminishing and will diminish more as we look at federal adjustments to the reimbursement payments. They will decrease, so will the providers. Access will become even more limited, and people will be forced into using emergency rooms as their only point of timely access, and the numbers will decrease. They won't decrease at all, although that's the exact opposite of what the expansion is designed to do. So on the surface, it appears that the Medicaid expansion component in the Affordable Health Care Act could be a deal too good to pass up. However, I'm confident that as legislators who are responsible to the people who sent us here to make good decisions on their behalf, we can see through any sales talk. Just remember that MA expansion plan is about increasing the entitlement health care coverage without any guarantees of increased accountability, improved access to care, higher quality, or lowering the cost of health care. However, it is one step closer to a federal government socialized type medicine program, and sadly, it will cause further loss of patient control over our own personal health decisions. So let's just step back a little. Let's capitalize on the wisdom that our constituents count on with us. Let's identify the realities first of our own financial footing, question the sustainability before we make a promise to fund such a magnanimous, such a huge ticket item. We can't afford to simply shift a problem with no real solution at the end or anywhere in sight. Fortunately, the federal government has not set a deadline for our states to make a decision on whether you're in or out on the expansion. I'm hoping that we'll take enough time to look at the issue, take some of the mystery out of it. Look at it in a bipartisan manner. It's not a party issue when it comes to caring for our most vulnerable citizens. We can't afford to make it a partisan issue. So, from my estimation, it would be irresponsible to alter our very vital safety net MA program and crowd out those that need it most, which it will, further limit their access to care, which undoubtedly it will, take more decisions away from the patients, and simply turn the program into an expensive, taxpayer-subsidized insurance for, additional people 18 to 65 who are more able-bodied, uninsured individuals. Expanding this failing program that even now provides often some of the worst outcomes to our recipients than even those who don't have insurance at all. And it does so by saddling the debt on our children. That's not the right decision for Pennsylvania. We can do a better job. We can't afford to potentially weaken an already and critically important program. We need true reform. We need innovation that will allow us to enhance our best practices so we can ensure that the program is more responsive to the people who need it. If you've ever gone shopping, you know that one-size-fits-all label rarely fits anyone, and that's the case here. We need flexibility so that the state can design an MA program that works for our particular population here in Pennsylvania. The current system's locked into the federal government dictates. It's antiquated, it's inefficient. It makes no sense to expand what's broken until we fix it, and we're able to deliver the level of quality that our patients in the MA system deserve. It's in our hands. It's in all of our hands and the Senate. Let's take the time to do it right. Avoid a very, very risky investment. If we make a promise, let's make sure Pennsylvania can keep that promise. Thank you, Mr. Chairman.
Thank you, Representative.